I used AI to click a photo of whatever book I can't understand, whatever paragraph I can't understand, and I used to understand via AI.
So during your profs, did you use any video source? So Dr. Harsh, you mentioned custom modules. Which tags did you give?
I think I had gotten something like 104 or something correct.
What is the advice that you will like to give for the INICET November aspirants? Hello everyone. So today I have very special guest Dr. Harsh Nawal with me, who is multiple times gold medalist. I also don't remember how many gold medals he got. I think in future he will also not remember. And recently in the INICET 2026, he got a rank of AIR 26. Hello Dr. Harsh.
Hello everyone. Hello Mayukh. It is a pleasure to be here for this podcast.
So this will be a brutal truth podcast. No sponsors are there, so we will exactly dive into the fact that what sources did Harsh use. So Dr. Harsh, kindly tell your MBBS preparation. How were you doing in the MBBS? What sources you used for the MBBS profs and for the PG preparation when you started thinking of preparing for the NEET PG or INICET?
Okay. So as we know, there are 4.5 years of MBBS. So throughout that, uh, like being also from Medical College Kolkata, the academics or the environment is very academic oriented over here. Everyone is into studying, all the professors. The environment is very academic friendly. So throughout, I used either Indian textbooks for most subjects along with past year questions, and standard textbook very rarely for references or for things which I do not understand. And very often I check the explanations of those standard textbooks, because nowadays many YouTube channels, they pick up screenshots from Harrison's or such textbooks and they explain them in detail. Or I used AI to click a photo of whatever book I can't understand, whatever paragraph I can't understand, and I used to understand via AI. So this was for prof exams. During prof exams, I was not very much sure about what to do about NEET PG. However, it was only towards the later part of final year that I thought of, at least even if I don't start, if I can prepare, how will I start eventually? So I laid out the foundation. I asked seniors who had scored good ranks, 2 years senior, 1 year senior, seniors who are still preparing. So I took feedback from everyone and I tried to create a rough idea so that once internship starts, there's barely any time to understand what to do. There's no time to sit and ask and call people. So throughout profs, I followed the routine thing which anyone follows. Final year, I started understanding what to do, and in internship, I think I dedicatedly started.
So during your profs, did you use any video source or any QBank during the profs?
During profs, I did have subscription of Marrow, and I had a Plan C subscription for 3 years, which was from second, third, and fourth year. However, it was, I think, because of my inability only that I could not utilize it fully. I did have it, and I could use it only for topics which I could not understand, or I used it specifically for subjects for which I was preparing for gold medal exams or class assistant exams. So it was for those subjects. I could not watch all the videos, which I, in retrospect, probably could have. So I use it very selectively.
How did you manage the hectic internship along with the INICET preparation?
Okay. So as I said, I already had the framework of what things I want to do, what sources I want to follow. So because of that, during internship, my basic orientation was that wherever I can get half an hour or 10 minutes of time anywhere, I would just try to take out a custom module of 10 questions, or if I would open a PDF, I would just read anything randomly. It was not very oriented that today I will do this. I thought, because if anyways I'm studying during work, I won't be 100% efficient. So I could not make a timetable, rigid timetable. So whatever custom module question came up, I used to solve those 10 questions in 30 minutes, and then I used to understand them in the next 20 minutes of review time. So that is what I did during internship. And wherever there was 1 or 2 hours where I know, like for example, ward duties, where there's morning ward and evening ward, in between that we have some time if there
Yes.
is no on-call emergency. So during that time, I used to carry one book in my bag always. So during that time, I used to just open the book, read, add things to it. That was the
So
plan.
Dr. Harsh, you mentioned custom modules. Which tags did you give in the custom modules?
For custom modules, I used to be very specific to not include everything. Wherever possible, till I was confident about PYQs, I used to add only recent NEET and AIMS tags. Till I was
Okay.
confident about PYQs that I can manage If till I'm getting 90% correct, I have to keep solving. So till I reached a level of confidence that okay, now I can expand. After that, I added clinical, sometimes instruments, and numericals. I think there was one tag, something
Yeah.
like that. So that used to be added. I used to
And
avoid eponyms and
okay.
controversial just to keep my brain clear of the clutter.
Okay. So did you use any QBank or you focused only on the custom modules and the previous year question modules?
I did not do the Q bank rigidly because I have always been of the opinion, which many people might disagree. I think the Q bank is not very exam oriented. It has been made based on modules, but it also has things outside. This is for any platform. So I always think that the Q bank modules don't have a very good strike rate, what I feel.
Yes,
So I
definitely.
always feel that if I, let us say, spend 1 week in solving FMT Q bank or any other subject Q bank, I don't think it will give me much of a yield. But if the same time I invest in solving 1,000 PYQs, I think that will give me a better yield. And if
Yes.
at that moment where I thought that I should expand beyond PYQs, that time I use custom modules, because the advantage of that it was a mixed bag. So it was
Yeah.
not like I'm solving only one subject, I'm leaving other subjects. So if I have to solve, let it be randomly.
Yeah, yeah. The thing about the QBank is that it is being set not by the faculties but by the postgraduate trainees. So some things are important for their maybe curriculum, but that is not important for the NEET PG or INICET. So we get many questions which are not there in the notes and that are not important also
It
that
is,
much.
does not reflect the exam pattern, I
Yeah,
think.
and you can listen it from the toppers so you can stick to the previous year questions and custom modules. So, Dr. Harsh, how was your GT scores and how you analyzed the GTs?
So GT scores. Firstly, I since I had a Marrow subscription, as I said, I solved Marrow GTs only almost throughout. Here and there, I solved some from other platforms just for the experience, but mostly it was Marrow GTs. So, as I said, I started off at the beginning of internship at the end of final year. So that was the time when I just gave one baseline GT just to
Yes.
know where I stand in at the
Means you
present day
started after the final year.
after final year and
Oh,
before internship, in that
okay.
1 month gap somewhere over there. So in that I started, and I think I had gotten something like 104 or something correct, just
Okay.
around 100. So that was where I started, and then I started studying properly. Uh, my revision notes, all the notes which I had in mind that I will start. So after that, I started giving GTs 2 monthly, 1 monthly, random day. There was no schedule for me. Whenever I thought like okay, I've made some amount of progress in some subject or in some subjects, that was when I thought ki, let us give one more GT, and if I had time that day. So I gave that GT, and then I used to attempt, like all my seniors always said, that you should always try to attempt 190 plus if you're giving a
Yes.
GT. That because that guess, if you start skipping questions, you will never focus on improving your guesswork. Even in the
Yes.
worst situations, you should know how to try to guess your way out. So I always guessed, so as much as I could. So out of that, I saw that my scores increased from slowly from 100 to 110, 120. There was a long plateau, I think, for around 4 to 5 months, around 120 to 135. I think that was a big plateau for me, during which it was very disheartening also at times, because I had done my notes for once or twice, and I had added all the PYQs or PYQTs, PYQ topics, and I couldn't understand what more to do. And my score was stagnant. But I it was then when I tried to explore some secondary sources, uh, for which I particularly used Prep Ladder LRR videos, which are available on YouTube for free.
Okay.
Prep Ladder 100 one-liner videos,
Okay.
not necessarily pep ladder, any teacher or video which I found interesting.
Extra
uh,
information you added and did it reflect in your GT scores?
yes, yes, I think firstly it made me confident, because notes, revision notes obviously will have big gaps in them, because it is very fragmented naturally for any notes. So I
Yes.
think another source which has its own fragments, I think when they are merged, I think it gives a good result. But this is only when you have time and when you are confident about your primary source, only then
Yes.
I ventured out. And not just that, I whenever I use a secondary source, I made sure that whatever video YouTube I'm watching, I add that information to my primary source. I do not
Okay.
create a new notebook, or I do not take screenshots, or I don't save the PDF, because that I don't, in my opinion, I don't think that ever works. Like one
Yes.
day before the exam, nobody can imagine opening a second source for the same subject because there's so much pressure. So that is what I did, and I think it did reflect because I think I my confidence in general rose, and despite the same number of attempts, I think I crossed 140 a couple of times. And in the last duty which I had given, which was around 10 days before the final INICET exam, I touched 150 or 151 corrects.
Okay,
So
what was your rank in that mock test?
in that
Approximate.
mock test, I think my percentile, I think I remember, it was around 99 point something percentile. So it was under 300 All India rank, something like that.
So we can understand that the rank in the GTs, that doesn't matter.
Hmm.
You will have to focus on your improvement, maybe how to expand your horizon. Like you expanded your horizon from one primary source, and you saw other faculties videos also to know their perspective. I think that is the thing that clicked for you. And the main exam day performance is one of the major things, because you can make your rank in a range. Like he had maybe a rank of top 10 to top 300 in a range.
Hmm.
His exam day performance was among the perfect, and he got AI at 26. So you can bring your performance into a rank range. So try to increase your rank range to closer to the top rankers. Then only if the exam day performance also goes wrong, then also you are in a good spot to get a good seat.
Correct. I think that is very aptly because I think in when you're giving a GTM and analyzing, you should focus on your scores primarily, what your
Yes.
corrects is, and not just that, what is it in comparison to the previous GTs. I think that is more important than seeing the percentile or the rank in any way.
Did you analyze the GTs with any of your friends, or you solely analyzed the GTs?
GTs I always analyze solely because
You gave on a tab or on a PC GTs?
I usually gave it on a tab because it was convenient. But
Okay.
towards the end, I gave one or two just for the feel so that the final day I know what the screen will look like. But usually it
Yes.
was tab because of convenience. But if
Yes.
it is convenient for someone to use a laptop, I think it is better only to use a laptop.
And did you give any DAM CBT or any CBTs?
No, I did not give any CBTs primarily because I was not aware of one happening. But I
Okay.
think if I would have known, then it's a good exposure. I think.
Yes, exposure is good. You get the exam hall feeling,
Correct.
but the problem is that the DAM CBT does not simulate like the main exam. You get many one-liners, very less image-based questions. So that is the problem I am hearing. But if you have option, you can go for a CBT. What are the sources that you use? As you mentioned, you used Marrow, some LRR videos from Prep Ladder. Are there any other sources?
No, I think the core foundation was Marrow, rapid revision notes and videos. And along with that, the PYQ topics, not just the questions, the topics were added. And
Did
even,
you annotate that in your main notes?
yes,
The extra points you are getting in the.
they were annotated in the revision notes. Yeah,
Yeah, yeah.
all the extra points, all the extra topics, in fact. So the revision notes, if it was let's say n before, after adding, I think it became 3n or 4n, if I'm not wrong, because there's so
Nice.
much to be added. And even there were some random theoretical questions here and there. I even if it is not possible to add the whole topic, sometimes you just have to add that one statement. So that if it gets repeated in the exam by any chance, at least we'll have an idea of what to do.
What is that one additional factor which you think in your preparation that others don't utilize, but you utilized and you got result? I think one of that is watching the LRR videos and annotating them in your notes. Is there any other factor
Yes,
you think?
I think adding the LRR videos I think was pertinent more for me because I said I could not use the main videos in my college life. I could not use them nicely. So I think that is why LRR served as a substitution for me. But I think for someone who already has watched a lot of main videos and is now doing RR, I think in the back of his mind he will have some of the main notes knowledge. So it could not be as important. Everyone will have their own X factor. But I think one thing which was I think a little bit of consistency. Every day
Yes,
could not
definitely.
be a long study day. Wherever there were days of holidays in my internship, some Sundays, some days during the week, some days after 24-hour shift, I think I made sure to just study as much as I could. And even during duty days, I think Even when we are not doing anything, if you're just having to sit somewhere, opening the phone, doing a Q bank, going through any PDF, I think somewhere it builds a habit. Even if it does not increase your knowledge, it builds a habit. It keeps you serious towards your goal.
Definitely, I will say that it increases your knowledge also, because
Hmm.
the RR notes I used to see in my mobiles, I was not preparing in the first 6 months. Next 6 months, I strategized and prepared. But those things that were in my memory also came to be useful during the exam day. I think
Correct.
that is not that much systematic, but ultimately it gives you the result,
Correct.
the small little efforts. So this time INICT we found that it was very much difficult. And how is the INICT preparation different according to you?
I think I have a very different answer for this. I honestly did not have any different strategy for INICET or NEET PG
Okay.
because as I said, I kept the same notes as my structure, and my only motive was to master those notes or to master any similar topics which could have come. Many people have out of the opinion that topic is only for INICET, this topic is only for FMG, this topic is only for NEET PG. But honestly, I thought that if I start getting into that business, I will now have to remember what all can come, what all cannot come. For me, I have a set of 20 notebooks which I have to study. And to be honest, if I would have given NEET in the future, then also I would have followed the same notes, I would have given the same duties. So I don't, for personally for me, I don't think I would have prepared anywhere differently. Just one thing that in INI set, if we're giving, I would have, I did try to just go through the new drugs list once,
Yes,
saw the
recent
recent four
FDA
or five Nobel
drugs.
Prize winners and what they won for. I think this
Yes.
was just one extra thing I did, but I think doing something completely new or different is not a good idea, in my opinion, because these exams are so back to back. And if we keep changing our preparation strategy, that
It
is
will
also not.
confuse you more.
Yeah.
So what is the advice you will give to the MBBS students who are studying for their profs and also preparing for the INICT?
My suggestion would be that while you're preparing for your profs, if you can watch main videos, it is good for yourself, for in terms of NEET PG also and in terms of exams also. But I think in no way should you sacrifice your prof exams or your gold medal exams or your semester exams for the sake of NEET PG so early in first, second, third, or final year. Because at the end of the day, what we study in these profs only, it is the knowledge we carry forward throughout the rest of our lives. If we start focusing on revision videos or LRRs or BTRs or other such sources throughout our college life only, then I think the foundation of MBBS will not be there. We all have to study for entrance exams, but I always felt that internship would be a good time because we are learning practical work from the wards and theory knowledge from our books. So while you're in college, I think you should focus on your textbooks, you should focus on your past year questions, and you should focus on doing main videos if you can. And eventually, I think whatever you learn, even during semesters and from the textbooks, that also helps you in your NEET PG. Because if you have
Yes,
not studied
definitely.
any subject in final year nicely,
The
then
base, the foundation which you are having,
hmm,
that massively affects. Like
correct,
you had the foundation in your MBBS, so that only reflected. You just needed to give a systematic effort for the INICT or the NEET PG preparation, and you got the result. So the foundation is the main important thing. So MBBS students, those who are watching this video, the one take home point is that you consolidate your foundation. Your target is NEET PG INICT, but your ultimate target is to become a good doctor. And you can become a good doctor by your clinical knowledge and also your theoretical knowledge, and obviously the communication skills. What is the advice that you will like to give for the INICT November aspirants?
for the INICET November aspirants, I can just suggest that first of all, everyone I'm guessing is also going to give NEET PG who I was going to give INICET.
Yes.
So I think your primary target, don't think that my goal is INICET November. First, think that your goal is NEET PG. Give it as almost as you're giving INICET, so that you have an experience. You have to try to aim to finish your syllabus and gain whatever confidence you can, assuming NEET PG is your INICET. And when you give that exam seriously, only then you will know what your reality is, what subjects are weak, whether you can handle the exam day pressure, how did you handle the 2 3 days before the exam. That is also very vital, I think. So if you do that seriously, I think you will yourself gain a lot of insights about what you did. Because if, let us say, you have time management issues in NEET, then you know that for INICET, before, in that gap, whatever GTs you are giving, you will try to solve it 5 minutes earlier, so that even on the
Yes.
final day, which even in the worst case scenario, you will be able to finish your paper. So I think give NEET PG seriously, very dedicatedly. Don't think that I have INICET, I have INICET. So I think that is one of the advice I can give.
Thank you, Harsh, for
Thank you
coming
so
in
much.
my channel and giving this amount of knowledge. And if you also have any questions, you can let us know in the comment section below. And Dr. Harsh, through his YouTube channel, is
Someday.
it
Sure.
will try to answer in this video also in the comment section.